Hello, I'm Dr. Rafi Romano. Today I'm very delighted and pleased to present you one of the most exciting techniques in my clinic to align teeth. And this is the Invisalign. I'm sure most of you have heard about Invisalign, but today I will give you a really nice overview of all the system, what the characteristic and what is the difference between Invisalign and other transparent clear aligner systems. Invisalign is combined from a series of transparent aligners. Each one of them is made by a material which Invisalign has patent on. It is called SmartTrack. Each aligner is packed in a separate plastic bag with the patient name and with the aligner number. Each one of the aligners is actually following the previous one. If you look at the aligners, you can see that each one of them is marked with a laser marker with the case number. Case number is similar to what you will see on the plastic bag. And there is the aligner number, which is very important because many times patients, they forget which aligner they are now. Sometimes they are not coordinated between the upper and the lower, and they have to see exactly what number of aligners they are wearing. They can see it by the laser marker. The aligners cover the teeth completely and in a 1 meter distance, which is probably the most common distance that one person talks to each other. You cannot see that the aligner is in the mouth, as you can see in these two examples. The lower picture is a patient that has spaces, and when he wears this aligner, the spaces is kind of disappear or covered by the plastic. The treatment process is like a road trip. If you take a road that is, let's say, an 80 miles or 80 kilometers, and you separate all the miles into steps, and each step is actually progressing, which means that if you did not pass completely the whole kilometer or the whole mile that you have run or walked slowly, you cannot move to the next one. So many times we find problems when patients are not cooperating or when the teeth are not moving and they keep changing their aligners, and therefore the treatment fails or the aligners do not fit. Only the orthodontist, as we will discuss, is the one who is planning the treatment. Many times patients think that, well, they will go to many doctors. Each doctor will take impression, send to Invisalign. In Invisalign, there will be this wonderful orthodontist that is most probably more clever than we are, and he will plan the treatment. He will make the aligners, and therefore there is no difference whom we will go or who will do the treatment, and it's only a question of price. So I want to acknowledge you that Invisalign provides you only the technical support, which means you are the master of the treatment, you plan the treatment, you decide on what biomechanics can work and will work, and they will provide you a plastic aligner that will actually produce the forces that you have planned. Patients should wear the aligners 22 hours a day. I have a lot of questions from patients, and they keep asking if I'm going to wear it half day, if I'm going to wear it part of the day, and it will take longer. That's not true. The idea behind this system, it's like braces. Not different from braces, except that you can take it off when you want to eat, when you want to clean, which is of course more convenient and more comfortable to many adults. But the idea is that we have a continuous force, which is the whole day. 22 hours for the teeth means the whole day. We can have a rest if it happens that you have an event and you are not wearing it one day for a few hours, nothing happened. But if it repeats again and again, as you can see in the picture, at the right lateral incisor, the upper right lateral incisor, you can see that already there is a gap between the aligner and the tooth, which means that this tooth did not move. It's not necessarily because the patient did not wear it, we will discuss it later, but that's one of the signs that we can see that the treatment does not go as planned. Now, the orthodontist is not only deciding on the treatment plan, the orthodontist also decides on the timing. Many times we have initial movement in certain teeth, and then during the middle of the treatment or towards the end of the treatment, we have movement of other teeth. And the orthodontist should be aware that he can look in the software of Invisalign and really diagnose and decide on the stages of each movement of each tooth. There is also this small composite collar tooth button on the tooth, which is called attachments. As you can see on the left side of the screen, you can see that it is marked in red. It has different shapes. The shape can be elongated, it can be like a button, it can be like cut in the middle. Each one of them has a special design and a special target, special role in the movement of the teeth. Some of them is meant for retention. We want this aligner to be well fit and well retained in the mouth. And some of them is an active attachment, which means that this composite button, as you can see on the right side of the screen of the maxilla, you can see this composite collar tooth button, and some of them are active, which means that when you wear the aligners, this composite button, this bubble, actually push the tooth towards its direction to where it was planned, whether it is rotation, whether it is extrusion or intrusion, and sometimes torque movement of the roots. In some cases, we need many attachments. Patients should be aware that this is how it's going to look. It's not as aesthetic like this case when patient has almost no attachments or attachments in the posterior teeth, but when it is needed, it is needed. If the doctor is giving up on these attachments when they are needed for certain movements or for retention, it means that these teeth may not move on the direction that we have planned for them. So this is part of the technique, and the doctor usually discusses with the patient on these attachments before he confirms the CleanCheck. You can see here how the case look when the patient is wearing the Invisalign. Usually the aligners touch the line of the gingiva, follow the curvature of the gingiva. Sometimes there is corners when there is sharp side of the aligner and the doctor can polish it. Sometimes even the patient can take something like you polish your nails and polish these sharp edges. Usually it is very comfortable like a glove, and patients get used to it in no time. This is a closed look of the upper and lower jaws from the inside. You can see the line that the aligner passed. Usually it's not irritating the gingiva, it's not touching the gingiva, it's just floating on the gingiva. Why Invisalign? Today there is so many other techniques. All of them promise transparent clear aligners, like clear aligner, Ecliner, clear correct. There are so many around the world. Why Invisalign? Well, I'm working with Invisalign from 1999, and I can tell you that the amount of money that Invisalign spent on technology like the iTero that help you to scan and not to take impression. You can scan the model or scan in the mouth and send directly your impression. The numerous articles and the research and development that you can see is amazing. You can see articles already on 10 and almost 20 years of research of this Invisalign. And now, in the last few months, they are launching a new software which is called CleanCheck Pro. And the CleanCheck Pro enables you to control all the movement by yourself, meaning that you can, of course, keep sending your instruction to Invisalign technicians, but you can actually influence every movement of the teeth and view what happened when you want an extra torque on a tooth, how it will influence all the mechanism, everything that happens. You can see numbers. You can decide on, you can do simulations of a case with stripping versus extractions, with proclination versus distalization. This is one of probably the most amazing software that was launched in the last decade. So this is why I'm working with Invisalign, although that some people can argue that aesthetically they all work the same. Thank you very much, and I hope to see you in my next series. In my next lecture, you can see case presentation done with Invisalign. Thank you.